One of the unique complications or issues after LVAD surgery is to take care of the right side of the heart, because the LVAD will support only the left side of the heart. The LVAD surgery again is becoming safer and safer. We learned many things in the last 5 years, especially the patient selection, as well as how to take care of the complications related to this technology. At the time of the surgery, LVAD surgery shares the same risks of open heart surgery, such as infection and bleeding. One of the unique complications or issues after LVAD surgery is to take care of the right side of the heart, because the LVAD will support only the left side of the heart. The right side of the heart has to work on its own. Special attention and care has to be provided to appropriately manage the right side of the heart. In the long run, this technology has been proven to result in better survival and better quality of life. However, in the last several years, we have learned this new technology might result in unique complications. These include bleeding tendency and infection around the driveline.